Amendment 69 is the Colorado Care Initiative, which, if passed, would be a 3.3% paycheck tax for universal health care. Businesses would have a new 6.7% tax, and if you own your own business, you'd be paying all 10% of that new tax. Here to talk about it with us is T.R. Reid from Colorado Care, the group that got the ballot on the measure, and Michael Cooke from Coloradans for Coloradans, which opposes the amendment. T.R., let's start with you real quick. We're on an elevator. Your quick pitch of why someone should support this. And I'm only going to the 20th floor, so.
As you said, everybody will pay a tax for it. The tax comes to $25 billion. But guess what? This year, Coloradans are paying $30 billion for health insurance. And next year, Denver Post, they're going up 20%. That's $36 billion. So Colorado Care covers everybody. It lets you, not the insurance company, choose your doctor. And it costs less. Yes, costs less.
Michael, what's the #1 complaint, if you can just choose one, of the amendment? What's the biggest complaint you have about this?
And I have to tell you, it's almost impossible to choose one, but if I had to choose one, I would say that it puts the tax, the governance structure, and many uncertainties into our state's constitution. We haven't worked out the details of Amendment 69, and all of this will go into the state's constitution and make it nearly impossible to amend or change once we start to realize the issues.
Now, T.R., I kind of liken this a little bit to Amendment 64, where you had this framework of an idea, but XYZ still had to happen after it passed. There's a lot that still has to happen should Amendment 69 pass, and if it all doesn't happen, it would cancel Amendment 69. You're asking a lot of a voter to trust, after they've said yes, that the rest will take care of itself.
Oh, what we need to do is we have to get a waiver from the federal government to get out of Obamacare. If we vote for 69, that gives us a waiver from all the rules and mandates of Obamacare because we have our own system. If the federal government gives us that waiver, then they send us $13 billion a year to help pay for it. And our coverage is guaranteed because by federal law, we have to provide the same coverage as a mid-level plan, the silver plan, and Obamacare. So it's not risky. The private insurance companies, now there's risk. Their plans all say we can change terms at any time. We can't do that because federal law requires what we cover.
What's it take to get a federal waiver?
It's going to take about 9 or 10 months, maybe 12 months. The federal government is encouraging people to the states to do this. Both parties want states to try to do something better than Obamacare, so I think we'll get it, but it'll take us 9 or 10 months.
Michael, you support health care, that everyone should have access to health care?
Absolutely. My argument is not at all with the goals of Amendment 69. The people behind it are good people with good intentions. We have health care challenges in this state. We have too many people that don't have access to health care. We need to fix that problem. This is the wrong solution for Colorado for a variety of reasons.
Besides campaigning against Amendment 69, are you crafting ideas for lawmakers to perhaps introduce, should Amendment 69 not pass? Ideas that could be new state laws that would help the cost and the coverage of health insurance?
You know, my organization, Coloradans for Coloradans, is in place to really address this particular issue at this particular time. Coloradans for Coloradans will go on and serve other purposes. But right now the focus is no on 69. I'm not here because I bring another solution to the table. I have nothing on the ballot. But this is on the ballot, and this is something that will hurt Coloradans. This tax is disproportionately unfair on many groups within our citizenship, and it is a very risky proposition.
ICTR nodding your head rigorously.
Well, the No campaign has no plan to get everybody covered or to cut premiums because Michael's campaign is paid for by the out-of-state insurance companies. They have pumped in more than $4 million to buy our votes, and they told her campaign, gee, don't propose anything other than the insurance companies. With our plan, everybody's covered, we pay less, and you get to choose your doctor, and we're not shipping billions of dollars to out-of-state insurance companies.
It's almost like you scripted this transition. Since we're talking out of state, you just had a rally in Boulder with Bernie Sanders supporting Amendment 69. Bernie Sanders, former presidential candidate, current senator of Vermont, not a Colorado voter. Why do I care what not a Colorado voter has to say about Amendment 69?
He came here because he carried Colorado in the Democratic primary. He has a lot of followers. And he's a guy who stands for the notion that if our neighbors are sick or in pain, we ought to provide them health care. And that's what Colorado Care is all about. There are hundreds of thousands of people in Colorado living in pain, too sick to go to work. Don't you think we ought to provide them health care? If you vote no, you leave them uncovered. If you vote yes, we cover everybody. And Michael says that's what she wants to do.
What do you think about, so to his point of your campaign getting a lot of out-of-state funding, again, it's not, I mean, the insurance companies probably have a say in this or want to have a say in this, and they're not necessarily based in Colorado, but they have business in Colorado. Should a voter say, hang on a second, there is a lot of out-of-state money coming in?
You know what? We have been very transparent about our fundraising. And of course, as is the case with any issue campaign or candidate campaign, we file our campaign finance disclosures with the Secretary of State. We have received contributions, and large contributions from the healthcare industry. These are people who don't want to leave Colorado. They don't want to terminate their employees in Colorado. But unlike what TR just said, they are not telling this campaign what to do and what to say. They didn't launch this campaign. They are not running this campaign. They have contributed. We also have contributions from many other organizations, businesses, and individuals in Colorado. 50% of our contributors gave us $100 or less. And I would also like to say that Mr. Sanders, Senator Sanders, coming to Colorado for Colorado Care, he couldn't get this up and running in his own state. He should not be coming to Colorado and telling us to make the mistake that Vermont made.
Now, at his rally, he kind of answered the question I just asked TR about why should I care what Bernie Sanders has to say, because he said, this is step one in America. If we can get it one place, we can start to spiral to other places. I have a doctor for years under Colorado Care. Will I continue to be able to see that doctor for the same stuff I've always seen them for?
Absolutely. Under Colorado Care, you choose the doctor. We cover every provider in Colorado. It's the private insurance companies that have these narrow networks. You don't know if your insurance company is going to cover that doctor next year. They won't commit to it. We'll commit to pay any doctor, any chiropractor, any physical therapist, any hospital or lab in Colorado much more choice if you vote yes for Colorado Care.
You'll commit to pay them, but I read through the paraphernalia for Amendment 69 that there's a negotiation process between this new board and all of the providers. So the doctor might have to take less from the state than they currently do from an insurance company. Is that how I read it?
I doubt it. They now have to negotiate with the insurance companies. All doctors do. We, in our business plan, we say we're going to pay 133 to 150% of Medicare, and for most Medicare reimbursement. For most doctors, that's more. And if you look, the contributors Michael talked about, they've listed 0 doctors. We have hundreds of doctors, thousands of nurses have given to our campaign because medical professionals like the fact that everybody who needs health care can get it.
And Michael took exception with those last 2 answers. I'll give you the last word.
You know, we have the ability through Amendment 69 to choose our primary care physician, but that's where it starts and stops. We don't know about specialty physicians. If we have individuals in our state with chronic health conditions, they should be really concerned about this because they don't know that they'll be able to see their current specialists. They don't know that they'll be able to continue to receive their specialty medications or durable medical equipment. That is not spelled out in this amendment.
Michael and TR, thanks for joining us. Please read your blue book. Don't go and fill out your ballot just reading that long paragraph. Read something similar or concise. Stay with us.